Hello, everyone, and welcome to today's webinar, Mindfulness Strategies for OT Practitioners. My name is Amanda, and I'm part of the marketing team here at ASTA, and I'm going to explain a little bit about how these webinars will work. Each webinar presentation will conclude with the Q&A portion. You may begin typing your questions in for our presenter at any time during the webinar, but please note that we will only be addressing these questions at the end of the presentation, and we will do our best to address as many questions as time allows. And with that, let me introduce today's presenter, Donna Costa. Donna, you're on.
Okay. Hi. I'm Donna Costa. I'm currently an associate professor of occupational therapy at Touro University, Nevada. So it's very early in the morning here. I have been practicing mindfulness since about 2001. Taken many additional trainings because, as you'll learn in this presentation, mindfulness-based interventions are not something that are routinely taught in an occupational therapy curriculum. So I've taken several intervention trainings. Generally, these are week-long, and I've used mindfulness not only with myself, but with many different populations since 2001. So what we're going to do today is to define what we mean by mindfulness, what we mean by mindful practice. We're going to differentiate between mindfulness as a practice versus mindfulness as an intervention. We're going to recognize how mindfulness can lead to improved professional quality of life. And then I'm going to show you some resources that you can access after today's presentation for further learning. So I'm going to be using a number of terms in this presentation. Some of them may be familiar to you, others may be new. The first is mindfulness-based stress reduction, or MBSR. And this was actually the very first intervention that was developed by John Kabat-Zinn at UMass Medical Center in 1979. And what John did was to take the ancient concept of Buddhism, mindfulness concept, and translate it into a secular 8-week course in which participants would learn various mindfulness skills and learn how to apply them to their life. And mindfulness is, as MBSR, is practiced throughout the world. You can find courses in many countries around the world in many languages. And it's probably the most researched intervention of all of the mindfulness interventions. Mindfulness-based cognitive therapy, or MBCT, was developed in the late 1990s by Zindel Siegel from the University of Toronto, John Teasdale from Oxford, and Mark Williams, also from Oxford in the UK. And this intervention was developed initially very specifically for people with recurrent depression, identifying people who had 3 or more episodes of depression. Since its inception in the late 1990s, it has been adapted for many other populations. There's an adaptation for children who suffer from anxiety and depression. There's an MBCT-specific intervention for people who have cancer. And in the United Kingdom, MBCT is actually the leading intervention, the #1 recommended intervention for the treatment of depression. And that's according to the NICE guidelines, which is their clearinghouse for research information. Mindfulness-based interventions are all of the other interventions that have been developed as a spin-off of these original 2. And they are numerous, with new interventions coming out on a weekly basis. Mindful practice is particularly relevant to practitioners from all fields. And that's where we take the concepts of mindfulness, the practice of mindfulness, and we embed it into our daily professional practice with our patients, clients, and consumers. And then presence moments is a term that has been developed by Denise Reed, an occupational therapist for Canada, where she talks about encounters that we have with patients, where we are present with them in the here and now. And she terms those presence moments. So, moving on to our next slide, let's look at a definition of what mindfulness is. Again, this comes from Jon Kabat-Zinn, and it's the one definition that appears the most often in the literature. Mindfulness means paying attention. That's the first part of it. Typically, we pay attention to our breath, but we might also pay attention to sounds, to a particular object. We might pay attention to a particular bodily sensation. We might tune into one of our senses if we're engaging in mindful eating. We do this in a particular way. Again, focusing our attention. And perhaps we're noting our breath, or perhaps we're noting some other aspect. But there is a certain way to it. It's just not haphazard. We do it on purpose, so it's very intentional. And most importantly, we do it in the present moment. And if you think about it, most of us are constantly rehashing what has already happened to us in the past, or we're worrying about what's going to happen to us in the future, what we're going to have for dinner tonight, the errands we have to perform. And so our thoughts are very often not in the present moment. So this ends up being a primary focus when we're practicing mindfulness or teaching it to our patients and clients, how to be in the present moment, the here and now. And then lastly, we do it non-judgmentally. And again, many of us, and this is not unique to occupational therapy, are perfectionists. We want to do it absolutely right. We want to get an A in our classes. We want to be the very best we can be. And there's nothing wrong with that, as long as when you make a mistake, you acknowledge it without beating yourselves up. And a lot of us are far more compassionate to others than we are to ourselves. So one of the things we work on when we teach people mindfulness is how to be non-judgmental, how to just accept ourselves in the present moment as it is right now. It doesn't mean we're happy with it. That doesn't mean we accept it and we're never going to change. But we know who we are. We're aware of ourselves in the here and the now. So this is just another quote from Jon Kabat-Zinn, and it takes it a step further. It's about being fully awake in our lives. It's about perceiving the exquisite vividness of each moment. We feel more alive. We also have more access to our own inner resources, and that leads to insight, transformation, and healing. And I love the picture of, the woman literally jumping for joy. Because that's the kind of feeling we get with mindfulness. Not that we're always happy when we're doing it, but that incredible sensation of just being in the present moment is quite unique to mindfulness. So why is this important? Why are we having this webinar? Because most of us are multitasking all the time. It is, in fact, a way of life. We talk on our cell phones while we're commuting to work. We scan the news while we're returning emails. And I dare say some of you listening to this are probably multitasking as well, because there are so many things on our things to do list that we think we have to do multiple things at once in order to get it all done. So in our rush to accomplish all of the tasks on that things to do list, we often lose connection with the present moment. We stop being truly attentive to what we're doing or feeling. So mindfulness is the opposite of multitasking. The idea is to focus our attention on what's happening right now and accept it without judging. And recent neuroscience research has actually shown that the brain can only handle one thing at a time. So if we are in fact reading and we have TV on in the background, or we're listening to this webinar while we're checking our emails, we have what we call divided attention. So half our attention is on one thing and half the attention is on another. We're not fully doing one thing or the other. So mindfulness is about all of our attention being on just one thing. So this is part of the definition. There's a lot of research going on into what mindfulness is and the mechanisms by which it works. And so there are basically three processes going on at the same time. The first is our intention, all right? We're intending to engage in this practice, and that's the on-purpose part of the definition. We're bringing our attention, our cognitive process, to the mindfulness practice. And then we're using a particular attitude, and that attitude is one of being open, curious, and accepting. And again, very important in cultivating mindfulness. So some of the characteristics of mindfulness or mindful practice is this non-judgmental observation, looking at something as it is, not trying to change it. Okay? We're accepting whatever is present in the here and now without trying to change it. There's this, what we call impartial watchfulness, looking at what's in the present moment in kind of an objective way. So if you have a sensation of pain somewhere in your body, looking at that. What is that pain like? How big is that pain? Where exactly is it? Does the pain come and go? Is it throbbing? Is it burning? What is it like? Really examining it. Non-conceptual awareness means we kind of turn off our thinking engine. We're not trying to think about what we're doing. We're just letting it happen. And present moment awareness, I think I've talked about, really working at being in the present moment. And that is something that you really have to work hard at. It doesn't come easy. Our minds like to be busy. Our minds like to be thinking about what challenge lies ahead of us. Non-egotistic awareness means that we're not doing this for ourselves. I'm restless and it's time to go to sleep and my mind just won't shut off. Oh, I think I'll meditate to try to go to sleep. Well, no, we're not meditating for a particular purpose. We're meditating to be in the present moment. We're aware of changes. And again, when we zone in on our breath or on a particular bodily sensation, we can become aware of very subtle changes. Our breathing slows. Our breathing becomes more shallow or becomes deeper. We become more aware of the physical sensation. And then participatory observation, we're in it. We are bringing ourselves to a seated posture if we're going to engage in a sitting meditation, and we're actually engaged. We're not reading a book or just listening to a recording about mindfulness. We're actually doing it. So this is actually very much like OT, which is about doing, not just observing. When you're mindful, you're present in the here and now without judgment. And so you experience life as it is. You experience yourself as you are. You experience others as they are. You're awake to life on its terms. And that means you're fully alive to each moment as it arrives, as it is, and as it ends. I keep hitting the advance button on the keyboard, and I forget that I have to push these little arrows. Sorry. So Epstein is a physician who's written a wonderful article. You'll see it in the references at the end, called Mindful Practice. And it was written in the Journal of the American Medical Association in 1999. But it's really a classic article, and I think a must-read for occupational therapists, because Epstein talks about how we can bring the practice of mindfulness to our everyday professional lives, to our encounters with our patients and clients, and still being aware of what's going on inside of ourselves. So he says that the mindful practitioner attends to their own physical and mental processes during every day, okay, to our ordinary tasks without any judgment. But the idea is that we're present for everything that we do within our workday. And as a result, we become fully present with our patients. We're able to listen attentively to them. We're able to act with compassion and insight and presence and bring our technical competence to the table. And this also helps with dealing with any strong feelings that we may have, either about this patient or about the disease or injury that they have. It will help us to make difficult decisions because our mind will be clear. We'll only have one thing that we're focusing on, and that's the patient or client in front of us. And it also helps with resolving conflict when it arises in the workplace. Epstein also says that mindfulness is an extension of what we talk about as reflective practice. So we're constantly reflecting about what we're doing, why we're doing it, how we're feeling about what we're doing, what we're noting about our patient sitting in front of us. So the mindful practitioner is present in all of that everyday experience. Actions, thoughts, sensations, interpretations, and emotions. So the goal of mindful practice, he says, is to become more aware of your mental processes, to listen more attentively, to become more flexible, to recognize when bias and judgments enter your mind, and act with principles and compassion. So there's quite a bit of literature on mindfulness. You can pick up virtually any magazine these days and you're going to see an article somewhere in that publication about mindfulness, as well as extensive articles in the literature. And I can't say I've read an article in the last 10 years that has reported negative effects of mindfulness. They always suggest the positive that has occurred as a result of somebody engaging in mindful practice or a formal mindfulness program like MBSR. So some of the things that have been found is that mindful practice improves mood, all right? You actually become happier. And part of that has to do with the functional changes in the brain. And so recent research in the last 5 years has shown through functional MRIs that practicing mindfulness actually leads to structural changes in the brain. That the areas responsible for positive emotion in our prefrontal cortex, in our left brain, actually increase. And then areas in our brain that react oftentimes with negative emotion, our amygdala, the source of strong emotion, the amygdala actually decreases in size as a result of an 8-week course of mindfulness. So these are profound findings, and more research is being done in this area. Of course, it decreases stress, and when our stress goes down, our quality of life, of course, goes up. We're able to better deal with conflict. Most of the mindfulness interventions demonstrate that they decrease anxiety and they decrease depression. Research that has looked at caregiving has shown that people actually are happier with caregiving. They're less resentful of it. Immune functioning improves. A study showed that after an 8-week course of mindfulness, it was specifically an MBSR course, that people had more antibody titers after receiving a flu shot than those that did not meditate. And so we end up being happier in relationships, having more self-awareness, and more balance in our life. Those are all good things. I don't know that there's a downside other than the time it takes. And we're not talking about huge amounts of time. 20 minutes a day will result in amazing effects. Whether you do that first thing in the morning, at the end of your day, in the middle of your day, at a lunch break, it really doesn't matter. Consistency is what matters, that you do it on a regular basis. Denise Reed, as I mentioned, is an occupational therapist in Canada. And so she has taken the concepts of mindfulness and applied them to OT. And so she says, it's not that we practice mindfully at a perfect time and place when we have the time, but we practice it throughout our day. We bring it to the everyday life of occupational therapy practice. And by engaging in mindful practice, we actually transform ourselves. And that is going to have an influence on ourselves, on our colleagues, as well as on our patients and clients. We're more reflective and we're better connected with all of them. So Denise Reed actually suggests that we engage in this 4-step process for becoming more mindful at work. That before you go in to see a patient or client, you kind of take stock, all right? You prepare. You kind of do a check-in with your body and your mind. You take a few breaths, okay? You try to really clear your mind of all the stuff that's floating around, all those thoughts, so that when you engage in the encounter with the patient or client, there's nothing except them, all right? And then during the session, you are actively available to them, all right? It's taking that relationship and making it, first and foremost in everything. And then, of course, afterwards, we reflect on the process. How did that go? What could have gone better? What might I do different next time? And we practice. We need to practice mindfully and engage in, say, 20 or 30 minutes every day. That's going to help us be able to drop into a mindful state during our busy workday. Michelle Elliott, also an occupational therapist, talks about that mindfulness has great relevance to occupation. We know that occupations influence health. Well, when we do those occupations mindfully, it actually magnifies the health benefits. We get even more out of it. We live life to the fullest in an even greater way. There's been some literature on, well, what's the difference between flow and mindfulness? And certainly they have some of the same properties. But flow is when you're engaging in an activity that has a very high level of challenge, and you have to bring a certain level of personal skills to them. Where mindfulness, we can be mindful during anything, while we're brushing our teeth, while we're making a cup of coffee in the morning, while we're writing our progress note on a patient we see. So it doesn't have to be a special moment or, only when we're sitting on a cushion that we're mindful. We can bring mindfulness to every moment of our everyday life. So we can differentiate between formal mindfulness practice, that 20 or 30 minutes we do every day, and informal mindfulness that we can engage in throughout the day. Just checking in with ourselves, noticing what's going on, noticing any sensations that perhaps are going on in the body. But again, applying mindfulness while participating in our occupations creates a new way of being with yourself, within one's world, and within the occupational choices present each day. And Michelle Elliott's article is also in the reference list at the end, and it's a wonderful read and has direct relevance to occupational therapy practice. So I would encourage you to take a look at that. Many of you might be aware that oftentimes we're on autopilot. We don't remember the drive to work. We don't remember what we had for dinner last night or what we had for breakfast this morning. Again, because we're multitasking. We're listening to somebody, but we're doing something else at the same time. We're eating a meal, perhaps alone or perhaps with our family, and we don't even notice what we're eating because we're busy doing something else. So again, multitasking leads us to missing that present moment. And we really need to put down our devices. They really do not help us. We think they do, but they lead us into states of divided attention all the time. So this is just a brief listing from a recent search I did on PubMed, looking at how many publications there are on mindfulness, on MBSR, on MBCT, and a growing list of articles that directly address mindfulness and occupational therapy practice. Now, mindfulness-based interventions, most of those are taught in the 8-week format. That's how MBSR started. MBCT is also an 8-week intervention. Some of the MBIs are a little shorter, some a little longer. For example, there's mindfulness-based chronic pain management that I currently use with people suffering from chronic pain. and that's a 13-week intervention. And it's longer because people with chronic pain tend to have very embedded patterns. They often have had chronic pain for a sustained amount of time, and so it takes longer to make a dent in that. But the most important thing, and it's emphasized in every training that I've ever been and every teacher of mindfulness, is you cannot do this work with your patients and clients unless you do this work yourself. You need to walk the walk, okay? You need to embody mindfulness. You can't tell your patients, oh, you should do some deep breathing. It'll help your stress, while you run around like a chicken without your head, okay? We've got to model for our patients. This is something I do every day, and it helps me, and I'll actually do this next practice with you so that you can see how it's done. That is the most effective way to teach your patients more about mindfulness. There are a number of assessments out there. Most of them are in the public domain. Some of them are long, others are shorter. Some of them, you'll notice, are for children and adolescents. Some are for very specific purposes, like the mindful eating scale. And again, more and more of these are coming out as the research in mindfulness continues to explode. So if you're interested in actually measuring the impact of mindfulness, any of these tools could be used, and you can find them on the internet pretty easily. This is just a very short list of some of the more popular MBIs that are out there right now. We've talked about the first two, mindfulness-based relationship enhancement, which again just focuses on the relationship between two or more people. MBRP is used with people who have addiction from some substance. There are two interventions for people with cancer, one based on MBSR, one based on MBCT. A newer one focuses on childbirth and parenting. There are several interventions now for children and for teenagers. There are programs that address problematic eating or disordered eating. I mentioned the one on chronic pain, and then mindfulness-based elder care, which has been used with people in long-term care settings. So MBIs are used for a wide variety of psychiatric disorders, but they're also used for a wide variety of physical disorders. And you can find numerous research articles on many of these. The last one on this list, urinary urge incontinence. I actually was engaged in a research study for 2 years at the University of Utah, and we found after 2 years, and this was with a nurse practitioner and a OBGYN physician, that mindfulness was as good as medication for women with urinary urge incontinence. This was a pretty big finding, and it actually got published in a couple of journals. So, good stuff. So I'm very briefly going to show you, talk to you about some basic mindfulness strategies. These are strategies that we often use with patients. You can do them right now, or you can just have them for your future. You can take this presentation, which will be posted on the AOTA website within 2 weeks, I believe. But the breath meditation is what we start with. And you ask people to sit in a chair in what we call an erect and dignified posture. Feet need to be flat on the floor, not cross-legged. Hands generally in your lap. You invite people to close their eyes, but you say if that's comfortable for you, and if not, to just look downward towards the floor. And then you just begin to focus on your breath. You don't change it in any way. You just follow each in-breath from where the air enters your nostrils all the way through to the end of the inhale. And then you start the exhale process following the breath to the very end of the exhale. And very often people have some initial trouble with this. Thoughts come into their head. And so the way you handle that is just acknowledging, oh, there's a thought. My mind likes to be busy. I'm going to go back to my breath. It's not, oh, I can't even do this right. I can't even sit here and meditate for 3 minutes. I'm going to give up. I'm a failure at this. No, you have to keep at it. And it will get better. We talk about with beginning, with people who are new to mindfulness and just beginning a practice, we talk about monkey mind. And if you think of monkeys, you know how they jump from branch to branch to branch. Well, that's what our minds are like. We jump from thought to thought to thought. And so we have to handle the thoughts in a very non-judgmental way. So this is the first practice. I will very often do it just for a couple of minutes, no more than 5 to start out, and then check in with people. How did that go? The next exercise, actually that's done, I'm going to advance 2 and then go back, is mindful eating. And with both MBSR and MBCT, they start with eating a raisin. And it takes about 5 minutes to eat 1 raisin. So this is very slow, deliberate eating. So you're selecting just 1 food. In this case, 3 raisins that are in the palm of your hand. And you're not thinking about anything else. You're not distracted by anything else. You're just examining this raisin, looking at it, smelling it, noticing everything you can about it, then putting it into your mouth, examining the texture, the taste, anything else that you can about it. Finally, biting into it, noticing the flavor that emerges, noticing any texture that emerges, and finally swallowing it and noticing the path that it takes, seeing how far you can follow that raisin as you swallow it. And then do that again with the second raisin. And people will often report that, they usually eat raisins by the handful, just kind of chucking them into their mouth. And they've never noticed what a raisin looked like or smelled like or tasted like. We often kind of inhale our food, or we grab some food in a drive-thru, and so we're driving and eating at the same time. And we wonder why we don't notice what we eat or why we have disordered eating situations. The other practice we often like to do with people is called mindful walking. And this is very slow walking. Some of my students call it zombie walking. And it's not about looking like a zombie, but it's about paying attention to the process of walking. And if you think about it, most of the time we're walking to get somewhere. We're walking because we've decided that's a good health practice, and so we're going to walk our dog, or we're going to take a brisk walk every morning. But mindful walking is not about getting somewhere. It's just the process of walking. So this is an exercise that's better done barefoot or with your socks on. You don't need much space. About a 10-foot long path is fine. You stand tall. You focus on your breath. And then you focus on the bottoms of your feet, noticing the sensations that come through the bottom of the feet, feeling the surface of the floor, noticing every part of your foot, and then beginning to take a step and noticing the body mechanics that you use to take a step, noticing how your foot moves from the weight being on the ball of your foot to the heel of your foot, noticing the point at which you lift your foot off the ground to take the next step. And you just do this very slowly, focusing on your feet in contact with the floor. You can do this on the sand if you live near a beach. You can do it on grass. You can do it on carpet or bare floor. It doesn't really matter. But you're quiet. You're not listening to music through headphones while you're doing it. This is a very mindful practice. And some people like this more if they find sitting very difficult. They're restless. So then we often will teach mindful walking because at least you can be moving. And when you get to the end of the 10-foot path, then you begin to turn, to notice what movements do I have to make in order to execute turning around and going back in the other direction. And you can do this for 5 minutes, 10 minutes, or even 20 minutes. But again, it's a very helpful practice. So, learning more about mindfulness, there's many different resources out there. If you just typed mindfulness into your Google search engine, you'd probably come up with enough information to take you through the next couple of years. So I'm going to point you to a few that I have found helpful. For those of you interested in research, there actually is a monthly publication called the Mindfulness Research Monthly. And this bulletin lists all of the articles that have been published in the past month and where you can find them. Now, obviously it doesn't have links to those articles. You're going to have to go to the journal. Some of the articles are actually explained fully, so there's usually a 1 or 2 page article on a certain aspect of research every month. But this is a 5-page bulletin that comes out every month. It's free to subscribe to it. And 5 pages of just new publications each month. That's how extensive mindfulness research has become. And the Mindful Awareness Research Center also has other offerings that you can find on your website. They have audio recordings of meditations, which sometimes people find helpful. They can't do it on their own. They need that guidance. And so an audio recording would be very helpful. And they also publish a list of online class offerings that they have, as well as in-person offerings. Another resource is more advanced training. So say you've already, had a mindful practice for several years, and you want to formally start offering mindfulness interventions. Well, you need to take professional training. And generally, these are 5-day professional trainings. Yeah, they're expensive, but there's a health benefit to just going to them. I will tell you that when I've gone on them, I have come back. It's better than a vacation because you're going to feel renewed. You're going to have energy that you didn't know you had. Your mind is going to be clear, and you will have learned a great deal about offering this intervention. So the Omega Institute is located in New York. They offer mindfulness courses on the East and West Coast several times a year. I will tell you they often have a long waiting list. So if you apply now, you might get in a year or 2. There are other places where you can take this training. The University of California at San Diego has a large Center for Mindfulness. If you go to their website, you can find audio recordings, you can find bibliographies, you can find class offerings, and then they have a professional training page. So they offer many different trainings throughout the year on some of the newer MBIs like mindful childbirth and parenting, as well as the standard MBSR or MBCT. And those of you on the call who practice with children, there really has been an explosion of interest in offering mindfulness training to kids. Dr. Amy Saltzman is a pediatrician in California, and she's developed a form of mindfulness called the Still Quiet Place. And so that's actually the name of her website, Still Quiet Place. I'm actually taking a training with her now. It's a 10-week professional training on offering MBSR to children. And there are many classes now being integrated into school curricula throughout the United States as well as throughout the world. There's actually a conference in February of each year that is just dedicated to mindful practices with children and teenagers. And you can find information on that on the UCSD Center for Mindfulness website. And I have extensive resources. There's 4 pages of references. Any and all of these will be very helpful to you in pursuing practicing mindfulness, offering it to your patients, or just engaging it in yourself. So I'm going to open this now to questions, and I see there's a whole bunch. I'm just trying to get my screen set so I can see them all. So Lauren asks, have I found an effective way to introduce, no, I don't see the whole question. Introduce the concept.
Donna, if you click on the question, it should open up for you.
Yeah, got it. To introduce the concepts of mindfulness to patients who are more resistant to those less common. Yeah, I oftentimes, to begin with, I will do it with the patient. So I'll say, why don't we practice some breathing together? I will not start off and use the word meditation, because a lot of people have some preconceived notions about meditation. I had one woman once that told me she thought she would have to abandon her religion, and she thought mindfulness was the Antichrist, and she was actually quite scared of it. And at the end of the course, she said, now I know it's the same thing as religion. It's actually very similar to prayer. You're focusing your attention on one thing. So again, I will start with just breathing and doing it with people. I might do eating, and it doesn't have to be a raisin. It can be any kind of food. But if people can just experience it first and get it, then they're going to be less resistant, and it'll be easier to engage them in the practice. Anna asks, these concepts seem to oppose point-of-service documentation that's often necessary to maintain productivity. Okay, so we're all being pressed to do more with less. We're being pressed to have 95 or 100% productivity, to see patients back to back, and that almost seems the opposite of being mindful. But even with that high productivity, you can help the process by, okay, so I've got to see 10 patients today back to back, but right now I'm just seeing one, okay? Or right now I'm just writing my note. And of course the tendency is, oh my God, I got to finish this note because I've got to see the next patient, they're waiting. So it's about focusing your attention on what is at hand right now. If you're offering mindfulness, again, we don't bill for mindfulness, but it actually will help, particularly when patients are anxious, to actually do some breathing in the beginning, or if they have pain, helping them to just calm down a little bit before you begin your formal treatment session. So that's what I would suggest. Janice says, I thought I heard Donna say that it's not meditation, but mindfulness practice of 20 to 30 minutes a day. It sounds like meditation. Okay, so there are many different forms of meditation, okay? Mindfulness meditation is just one. So I tended in this presentation to use the terms interchangeably, but I meant them to be mindfulness meditation. So it is a practice. It is a practice that we bring to our everyday life. I was originally trained in another form of meditation, TM, or transcendental meditation. Very different, concentrative. So there are health benefits in others, but this is the one that seems to be gaining the most popularity right now. I mean, it's really in the mainstream very much. Joyce asks if there's any studies on benefits of doing several short meditation sessions if difficult to do 20 to 30 minutes. And yes, there's a number of researchers that are really looking at what dosage of mindfulness do we need to have that health benefit. And there are several studies that have reported on interventions that are significantly shorter. So in my own experience, I teach at a university in Nevada, and for years, and this isn't the only place I've taught, students report very high levels of stress. But they don't have time to engage in an 8-week course of 2-hour classes. And when you take MBSR, there's about an hour of homework a day. There's no way that occupational therapy students can do that. But an intervention has just been developed out of Duke University, and it's called KORU, K-O-R-U, and it's an abbreviated form of mindfulness. So it's offered over only 4 classes. Each class is just 1 hour and 15 minutes, and students are asked to do only 10 minutes of practice a day. So I became trained in this a year ago summer. We've been offering Koru groups on our campus now since last fall. And we've been collecting data, and in fact, the same results that we see with MBSR and MBCT, we're seeing with students who've taken Koru. So their anxiety levels go down. We're using the perceived stress scale. Their sleep improves. We're using one of the sleep scales from the medical outcome study. And their affect improves. Positive emotion, specifically gratitude, improves. So it is possible to have the health benefits in less time a day. And some people actually have talked about dividing up 20 minutes into 2 10-minute segments, and that's fine too. Again, consistency is the most important. Anything you do repeatedly, you're going to develop some habits. And we know this because this is the foundation of occupational therapy. So we want to build this into our daily routine. Amy asks that you have a healthy habits program for youth. You're considering offering a mindfulness session. So do I have any recommendations? And yes, I would encourage you to start with Still Quiet Place. It really it takes that 8-week program. There's actually a book out by the same name now that walks you through the all of the 8 sessions. There are, different kinds of homework sheets. The vocabulary is much different, but it's been offered to preschoolers, school-age children, middle school, and high school. And there are different recordings for the different age groups. There's also a social worker in California, Gina Beagle. She has taken the intervention and adapted it specifically for teenagers. And so her website is called stressedteens.com. And she too offers an online training for people to learn how to develop the intervention. But there are many child-based mindfulness interventions that are being studied, implemented in schools around the country. Beth asked if there's been any research studies with OT or OTAs incorporating mindfulness into their clinical practice. There are. It's beginning. And I think most of those articles are in my reference list. There was an article that appeared in the British Journal that looked at incorporating with people who had rheumatic disease, different kinds of arthritic conditions. And OT in the U.S. Offered MBSR for people with chronic health conditions. There are several OTs in the UK, Rebecca Crane being the leading one, that have really gotten into mindfulness-based cognitive therapy for depression. And interestingly, when mindfulness-based cognitive therapy was developed and the very first research article was written, the groups were led. They had 3 clinical centers where the trials were done, 2 of them in the UK and 1 of them in Toronto. And all the groups were run by occupational therapists, not the psychologists who developed the intervention. So OTs are very much involved. Unfortunately, OTs don't always write about what they do in the research literature. So if you are using mindfulness in your practice, I would encourage you to be writing about it, presenting about it at conference. Let's see. Can you review if OTs can bill for mindfulness interventions? Technically, no. There are very few insurance companies, with the exception of, I think, Kaiser Permanente, that actually allows billing for the 8-week MBSR course. That doesn't mean you can't implement mindfulness as part of your treatment strategies with your patients' clients. You can integrate that rather seamlessly into what you do with people, and you don't have to bill for it. And if we think about mindfulness, it's really a modality. So we're working on something like skills training, like ambulation, functional mobility, but people are afraid, so we want to have them focus on their breathing, calm down a little bit before we actually engage them. So Claudine is asking a similar question, what CP codes do you bill? And again, you wouldn't be billing for mindfulness. You might be billing for, particularly if you work in mental health, for running a group of some kind, whether that's an ADL group or a stress management group or life skills. But you wouldn't be billing for mindfulness per se. There is, in other countries that have socialized medicine, mindfulness-based interventions are covered. But in the U.S., most practitioners that offer MBSR either do it as part of a research study or they do it as fee-for-service. That's the most popular way to do it. That doesn't mean it can't change, but right now that's kind of the state that we're in. Tanya says, you mentioned consistency is important. How long does it take for people to be able to see the benefits? I will say immediately. And oftentimes what I will do with patients is I'll have them first think about something very stressful that happened to them. And really imagine it as vividly as they can in their mind's eye. And I'll ask them to rate it on a scale of 1 to 10. So how anxious or stressed did that event make you feel? And they'll say 8. And then I will have them engage in a mindful breathing practice. And when we're done, then I'll ask them to once again bring that incident to mind and have them rate it again. And almost universally, the score goes down. Now it's a 3 or a 4. It doesn't bother them as much. So they see the benefits from that. That's more objective. But almost everybody, and most of my clinical practice has been with mental health populations. So I did a lot of mindfulness work in acute hospitals. Almost everybody can see an immediate benefit. Wow, I feel so much calmer, okay? Or I slept last night. And most dramatically, after the last 13-week group I ran for the people with chronic pain, I had one woman who had pretty severe myasthenia gravis. And she was able to say at the end that she had been able to cut her medication in half as a result of mindfulness. And another woman had completely come off her narcotic medication. Now, that was not the intention of the course, okay? But that was the benefit that they had as a result. Gloria asks, is it recommended to practice mindfulness in patients with active hallucinations? Originally, the thinking was no, but I can tell you there have now been some research studies where they have used mindfulness with people with active psychosis, and it has been helpful, okay? You're asking somebody to focus on something else other than their hallucinations, and that's probably why it's helpful. So they, just as we all will have interference from thoughts, people with psychosis will have interference from their hallucinations, to essentially treat it the same way. You know, if a voice pops up, just acknowledge it and return back to the breath. And so it ends up actually being quite helpful. Beth is asking, any studies with OTA students published on mindfulness training? And actually, yes, Denise Reed from Canada published an article, I believe, in the Canadian Journal. You should see it on the reference list. And she piloted an online mindfulness course with her OT students at the University of Toronto. I don't remember if it was a credit-bearing course or not, but the results in that article did show positive benefit from the students. And in my experience, students can benefit from almost any kind of stress management intervention. They're pretty stressed, and the closer they get to the NBCOT exam, the higher their stress level goes. Gerba asks, what has been your experience and strategies working with children in school setting? Again, my practice has been mostly with adults in mental health settings, so I can only tell you about research that has been done, videos that I have watched. there's an absolutely wonderful video that you can get, and you can actually stream it off Amazon for under $5, but it's called Free the Mind. And it's a Danish film that looks at mindfulness interventions with two populations, a group of veterans returning from the Middle East War that have severe PTSD, and a group of preschool children, one of whom has pretty bad ADHD. And they look at the different kinds of mindfulness practice, and they follow them over the course of time. And the film is interjected with various snippets of scientific research from Richie Davidson from the University of Wisconsin. It's a wonderful film, and it really can show you some of the benefits that occur with kids as well as with adults. Jacqueline says, you mentioned in the introduction that mindfulness is a primary intervention for depression and mental health diagnoses. And that particular intervention, MBCT, it's the #1 in the United Kingdom. So it's the NICE recommendation, the National Institute for Clinical Excellence. 2 years ago, they came out with a statement that MBCT should be treatment of choice. And they are now training practitioners in the UK to deliver it so that there's enough access and availability. How would I incorporate mindfulness into a phys-diz setting where people often have comorbid mental health conditions? Again, I would just try to do a mindful breathing exercise at the beginning of my session, or I might even do a mindful walking exercise, particularly if you're getting people up and moving. You're not trying to get anywhere again, you're just trying to focus on the sensation of walking and on the sensation of your feet meeting the ground. And an offshoot of mindful walking is an intervention of itself, and it's actually called Soles of the Feet. And it's an intervention that's been developed for a developmentally disabled population. It's been used with people who have autism as well as ADHD. And it, again, just takes this concept of mindful walking as a way to help people gain control of their behaviors. And so that you'll have to Google. I don't think it's on the reference list, or you can email me. But the intervention is called Soles of the Feet. Donna, your contact information, please. Yes. So it's donna.costa, C-O-S-T-A, at tun.touro, T-O-U-R-O, .edu. And we could probably add it to the slide, and it will be posted on the AOTA website. So, any last questions? Oh, Amy, see the last question. How do you document mindfulness goals and interventions for people with chronic pain or TBI? Again, mindfulness interventions have been used with both those populations. You're not writing a mindfulness goal. You're writing a goal around their individual functional levels, and you're using mindfulness as a modality. In some cases, it might be something you do at the beginning of the session, or you might do, throughout the session. You might actually give patients some resources, like a particular book or website that you suggest they go to get more information to help guide them through the process. And Gloria says, thanks, the session was great, and I would agree. Thank you all for coming. I hope you got what you came for out of this member appreciation webinar, and I wish you a great day. So thanks.
Thank you, Donna. Thank you for presenting. Thank you guys for attending, and thanks everyone for being AOTA members. Have a great day, everyone.